Well, hello everybody, and welcome back. I have with me here tonight Dr. Ben, officially Dr. Ben. Dr. Ben, congratulations, by the way. Want to start
Yeah,
off with
thank
that.
you.
How are
Yeah,
you
it's exciting
feeling?
that this is the first stream with the new rebranding, and you were the one that asked for this day, so you're the one that got it.
Good deal. No longer student Dr. Ben. We are fully fledged Dr. Ben now, right?
Absolutely, I'm feeling the pressure now because now I really have to know what I'm talking about because people can call me out even more.
Well, I'm it's kind of weird to I'm going to ask you a lot of medical related questions. I do want you to be relaxed because you deserve to be relaxed because you just accomplished a very incredible feat, but may put you to the test a little bit.
Well, and I'm always happy to let people know when I don't know something because there's probably going to be some questions that I don't have the best answer for, and I'll try and give my best opinion on it. But anything, I'm sure somebody might be able to correct me on certain things, and I'm open to feedback. So not everybody, like nobody knows everything, and you can't pretend to know everything, or you're just in for a miserable time. So.
Well, that's a very healthy attitude to have for sure. So let's start off. Just maybe tell everybody a little bit about who you are, what you do, and why I'm congratulating you, I guess.
Yeah, so normally I would say that I'm a med student, but I'm no longer a med student because I just finished my last day today. So I am about to enter a family medicine residency program starting in June. So I kind of, between now and then, have some vacation time, some much needed downtime before we get back into things. And I do a lot on the internet. I think a lot of you probably see me on Talk Heathen with the ACA or the Transatlantic Call-In Show on the line. Those are kind of the bigger shows that I do, but I also have my own channel. I actually have two channels. I have one on YouTube and then one on Twitch, and they're very different intentionally because this is actually a great partnership that we're having today on this stream because my YouTube channel, my main show is called Medical Myths, where we debunk bad science, and I'll go through various videos or articles and talk about why the arguments are not as good and how you can refute them. So this upcoming week, we're talking about artificial ingredients and kind of that whole fallacy of, well, Europe banned these ingredients and their stuff has ingredients I can pronounce, therefore it's healthier, whereas the American ones have more ingredients that you can't pronounce, so it's unhealthy. And there's a lot of miscommunication about food, especially. So we're talking about that this week, but I've talked about COVID in the past. I've talked about uh, Reiki and homeopathy and all that fun stuff. And then I have some lecture style videos as well talking about what is the mRNA vaccine, why doesn't it cause cancer, and all that. But then I also on Twitch is more of my casual content, so it's less educational, and I just do live streams for fun. And over there, my main thing is trivia. So I do every Friday
Nice.
at 9:30 p.m. Eastern time. We do trivia night, and everybody can play, and we just do some community building over there. So kind of two
Very cool.
different places, but some range. And I hope to see people that are watching this over at those videos.
Yeah. I've listed Dr. Ben's links in the description of this video. If you're interested, by all means, go check out his Twitch, go check out his YouTube. Lots of great stuff out there. And this is the main reason why I invited you on here. So my background is more so the history and philosophy of science, and I deal a lot with scientific misconceptions. There's a lot of, for lack of a better word, myths floating around out there about science. People misuse and misrepresent science in a lot of different ways, but medicine seems to be probably the most problematic area.
Definitely.
I'm not quite sure why that is, but more so than physics, more so than biology, more so than take your pick. There's so many, there's so much pseudoscience regarding health and medicine floating around, especially on social media.
Yeah, and I think it's largely because number one, people are scared. They're scared of what they don't know of their own bodies, and so if you have somebody, let's say they have COVID-19, which we're going to be talking a lot about today, and thank you, skeptics and scoundrels, good to see you here. Uh, well, I think people are scared when they don't know something about their body, and so that thought process we all go through to kind of rationalize our situations and make sense of the world and make us feel a little bit better, alleviate some of the anxiety. We take the unknowns and we try to make them more known, even if it's making up an answer. So people that are scared and don't know what to do, um, and maybe have trust issues with the medical community, which there are a lot of people that have very good reasons to be distrustful. And unfortunately, the field of medicine does not have a very good history when it comes to racial issues and and women's rights and LGBTQ rights. Medical research for a long time has prioritized cishet white men as the standard human. So it makes sense that people would be distrustful of the system. Um, but they then take the unknowns, give a bad answer, and then think I can handle this myself because then at least I have agency in my health. And they don't have the ability to really think through what's going on. They don't have the foundations of medicine. But from the outside, medicine looks very simple. And I think a lot of people don't know what doctors do. And I spend most of my time trying to communicate what doctors do to people that have never been one. Because even if you've seen a doctor before, if you haven't, even if you've worked in some other capacity of medicine and you have not been a doctor, you probably don't know what we actually do. Um, so I think it's all of that miscommunication
Mhm.
combined with the mistrust and just wanting to play a role in your own health and wellness. And I think all of that combines to give people some less than ideal ideas.
Right. No, I really, really liked how you put that, because there is oftentimes a legitimate concern that's being expressed here, even if it's not being expressed in the best way via a conspiracy theory. It's oftentimes rooted in some solid historical trauma.
Mhm.
So, which I do want to come back to, but before we dive into the conspiratorial thinking, I do want us to start kind of big picture, kind of the view from really high up here. Um, Explain it to me as somebody who barely passed my college anatomy course, anatomy and physiology. I still have horror flashbacks to it. Explain to me in as simple terms as possible, what is COVID and what are vaccines? Let's start there.
Yeah. All right. So I'm gonna try to explain this as all of you are very intelligent, but let's just say there's a 5-year-old in the room, and we have Nate Smith here. Welcome to the club, and and thank you for the congratulations. And I'm definitely not a homeopath or a chiropractor. Uh, but I'll start off like super broad, just in case there's a 5-year-old in the room that doesn't know what a virus is. But COVID-19 is a virus. This one specifically is I guess a bit more sidetrack to something a bit more complicated. It's an ssRNA or single-stranded RNA virus. So viruses are not alive. It's not actually an organism. It's some alien thing that gets into your body via your nasal cavity is kind of the main place that it'll adhere to. It uses proteins and things to stick to the walls, and it can infiltrate the body, and it injects its RNA into your cells and then uses the cell machinery to replicate its own DNA. And then the cells will break open and all the new little viruses will leave and they'll go find some more cells and they'll just replicate over and over. So it's kind of like a parasite, a parasite that's not alive. And COVID in particular, it's a vascular disease more so than anything else. So when we first learned about COVID, we were thinking it was more of a respiratory disease because we had seen people get a respiratory illness, and it enters through the nasal cavity. So it seemed like a logical connection to say that this is primarily respiratory, but we learned it's more vascular, and it acts on the angiotensin 2 receptors, is what we believe right now, or at least is the current hypothesis. And since it acts on blood vessels, it can have all kinds of systemic effects. So around the lungs, it can cause that respiratory distress, some acute respiratory distress syndrome, which is incredibly scary. Thank you again, Progress Only, for the congrats. We're probably going to see lots of that tonight. But you can get some nerve damage, like we're seeing with loss of smell and taste. That is a neurological deficit. It seems like a very small symptom, but we're noticing that people are they're having this for a long time and may not get their sensation back. So it may be permanent nerve damage. We're seeing people getting diabetes from COVID because if you cut off blood supply to the pancreas, you're essentially amputating their pancreas, and you can get diabetes that way. You're getting all kinds of diseases from this one virus. So I think that's kind of the simplest way to say it. It's a systemic illness that tends to present like a respiratory one, and therefore is more infectious via respiratory pathways.
Gotcha. And so you mention it, and I was typing in the chat, so I just want to make sure I understand this. So there are some people, and I know some people that have lost their sense of taste from having COVID. Why, again, from somebody that doesn't know anything about this, why is COVID presenting all of these like different, what's the correct term? Consequences, for lack of a better word, that we get it and then all this other stuff happens? Like, why is it causing so much in seemingly, from my perspective, unrelated things like taste, right?
Yeah, I don't know exactly the mechanism for specifically the neurological damage. I'd have to look more into that. But in terms of everything else, it's due to inflammatory pathways, primarily in the bloodstream. So you have things called cytokines, which everyone here has probably heard of cytokine storms. You get these little molecules that will just stir up a bunch of shit in your body and cause massive amounts of inflammation. So you end up having this path. There's a inflammatory pathway that needs to happen to get kind of severe inflammation. And with the cytokine storm, basically you're getting this cascade triggered that can't really be regulated. And so this dysregulation of the immune pathway is what causes a lot of the problems. So you can imagine that widespread inflammation can cause a variety of things. And that's why you see different presentations, just because based on where the inflammation happens to be, what can get into the bloodstream, what can go elsewhere. Reggie is a great point. The trivia questions. Yeah, I do write very hard trivia questions. And I think Dr. Ben might write more difficult questions than student Dr. Ben did. Maybe I'll get more mean. I don't know. We'll see.
All right. So we got COVID. Now, what is a vaccine and how do vaccines work?
Yeah, a vaccine essentially is a way to get your body to recognize the machinery of a virus or a bacteria or whatever have you. And so imagine, like, here's an analogy that I like to use. So imagine you have two countries that are going to war and they have their borders set up. And when you're in conflict, you don't want to let somebody else in, of course. You don't want to let the enemy into your border because that could be dangerous. But you want to be able to recognize which vehicles are the enemies and which ones are not. So let's say the enemy's vehicles have a very specific structure of the vehicle, or there's even a specific part like their license plate, or they use a particular tire type, or they have a specific logo on the vehicle. Something that would you would recognize it as an enemy vehicle. So you don't want to let the actual enemy vehicle in with that. But if somebody can get maybe a picture of this vehicle, say, I know what this looks like now, and then give the rest of the army the picture that says, hey, this is what you're looking for. So if you see this, go shoot at it or whatever. That's kind of what we're doing. So we're not letting the actual enemy vehicles in, but we're getting that picture of it, or like the small piece. Even if they took they captured a license plate from an enemy vehicle and brought the license plate back and passed it around, and now everybody knows which license plate to target. That's essentially what we're doing.
Gotcha. That makes sense. So I have some questions here for you, Ben. And by the way, for anybody listening, if you have any questions, feel free to post those in the chat, and I'll be sure to hopefully get to them in a somewhat timely manner. But so I let everybody know on my various social media platforms that I was going to be interviewing you, and I got quite a few questions. I was hoping to kind of fish out some juicier questions from some of my more conspiratorially minded friends. But I also, my wife is a nurse, and she's also in a nurse practitioner program. And so I do have some connections with more people who actually work in the medical field. And this first one is somebody I've actually interviewed for this channel, Lisa Zamet. And Lisa is a forgive me, Lisa, I've already forgot what a physician's assistant, and taught as a physician's assistant for quite some time. But Lisa had a question. She wants to know, I'd love to know more about the current booster timing. Are we still doing every 6 months, or only for surgeries?
I think it kind of depends on what the patient wants. I think like the kind of the minimum time frame is every 6 months. But there's talk of going to making it a yearly thing, especially with the bivalent booster. I think it's less clear still about what the actual right answer is. I think we're still waiting for some data on, because it's kind of hard to a lot of these guidelines end up being kind of guesses at first, and then you figure out kind of what you think the best idea is. I don't know if we know exactly what the right answer is. So I think people are still a bit more flexible on if people are more immunocompromised and need more protection, that maybe they still stick with the 6 months. But I'm hearing some people that have no medical history that are going to start getting it around the year mark, and we're not too sure exactly which is the right answer. But I think it depends on people's risk. But I think 6 months is still kind of like the recommended time frame.
Gotcha. Thank you for that. I'll let Lisa know that you've answered her question. We have another question here. This is from Mark. Mark's a friend of mine from grad school, but so Mark had a question about mask, and I do want to build off of this question because I think a lot of people have this question. So Mark says, I've heard mixed things about N95s and who all needs them. If I'm wearing one, am I safe to be around folks who aren't?
You're going to be more safe with that than with nothing, and you're going to be more safe with that than with another mask type. I mean, no matter what, you are taking a chance, because no mask is going to be 100% effective. It just severely decreases your likelihood. Especially you are with the N95, you're going to be way more protective, especially of other people. The other people around you who aren't wearing it are going to get protection from you. And you're still going to get some protection from them. And it's probably the best protection that you're going to get. I don't know exactly the stats on by how much. But if you are worried about your risk, that's the best way to go about it. If you want the optimum amount of coverage, the N95 is going to do a great job for you. We're still using N95s in the hospital, and it's a case where a lot of our patients are not wearing masks. And for the most part, the risks have decreased significantly by just the healthcare professionals wearing masks, even if people in the patient's room aren't. So definitely, if you're concerned, keep wearing it. It's not going to hurt you to keep wearing it, and it will just reduce your chances.
Gotcha. We do have a question from Nate, and Nate, I'll get to your question here in a second. Ben, I was going to ask you, kind of building off of this, because masks seem to have been one of those points that got like really contentious.
Yeah.
There were, and I'm sure you got more of this than I did, but there was a lot of, I guess there was a lot of uncertainty and a lot of questions about maybe why we were wearing masks in the first place. And then there were mask mandates, and then those mask mandates kind of got like gradually lifted. And now some people are like, am I supposed to wear a mask? Am I not supposed to wear a mask? So can you address kind of some of that gray area and those difficulties there?
Yeah, this ends up being an interesting conversation because we do know that masks are helpful in reducing risk. And especially if you're around people who are immunocompromised, or if you're immunocompromised, or you're around people who were exposed, it's a good idea to wear them. It got a lot of backlash when this all was going on. And there really is no concern for people wearing a mask. If you were to wear one, you're not doing yourself any detriment. You're not going to suffocate. Like, it might be uncomfortable to wear a mask, like going running or something, which you have to weigh that out for your own comfort. But the argument got really funny because a lot of these excuses people would give to either not wear a mask or whatever was like they make some reason why it was problematic for them to do that. It's like, but if it's that problematic for you to wear a mask, you probably shouldn't be going out in public where you could be exposed to COVID. Because, like, if you're comparing two things, if your lungs are in such bad shape that wearing a mask is going to stop you from breathing, then you probably should just stay at home and not be around people who are going to put you at risk. So it's interesting that it's like, why are people putting forward those excuses? And you break it down. You're like, are you really actually concerned? If so, you need to evaluate your reasoning behind everything else you do, and not just, I don't like this mask. You then have to evaluate, is it worth being out in public? Is it worth risking other people? All that. But if you just don't care about COVID and don't care about wearing a mask, like, don't blame the mask for it. Just outright say that you don't care and that you don't want to take any precautions. Like, just be honest about your reasoning, because it got very weird there. But you really don't need to have any concerns about wearing a mask unless you have some kind of medical history, in which case you should be talking to your healthcare team and figure out what is safe for you. Because I can't tell anybody. I don't know anybody here and your risk factors. So that's a talk you'd have to have with your team. But in terms of, I think we had mentioned the masks, and then there's another point that we're gonna.
Yeah, let me slightly rephrase this, because from my perspective, one of the things that was happening is there seemed to have been this public perception of, I guess, uncertainty, for lack of a better word, or not consensus, or the opposite of consensus, disagreement in the medical community about masks and about how effective masks are. Can you speak to that a little bit?
No, that's the interesting part, because we were in the medical community. You're constantly balancing, like, what is the absolute best course of action with what's going to be the best quality of life for people. And like the fact is we're playing a support role in everybody else's lives, and like there's an extent to where like yeah, if everybody on this planet wore a mask 24/7 and socially distanced all the time and didn't leave their house unless it was important, like yeah, you'd get rid of a lot of diseases, but you'd be pretty miserable doing that, and you lose contact with the world around you. And there is some sweet spot of what risk should we be willing to take and what risk shouldn't we. And again, that's going to come down to an individual thing, but like the medical community as a whole like has to understand that we're never going to be 100% risk free, and sometimes it's worth letting people take a bit more risk in order to maintain that quality of life. And with that, like if you're asking for compliance, you sometimes have to give a little bit so that people are willing to be compliant. Like again, if you tell people that you have to stay in your house forever and can't do anything, like people aren't going to comply with that. And if we're operating in shades of gray, because nothing is 100% black or white, if we're operating in shades of gray, it's like what's a good level of risk mitigation that we can enforce, that also doesn't it doesn't take away quality of life, but then also the fact that even if you're not perfect, but you're consistent, like if you have the majority of people being imperfect but consistent, you're probably going to get reduced risk even more so than if a couple people were absolutely perfect. So it's kind of balancing that out. Like, can we get the majority of people to be on board with this, or do we need to relax things a little bit? Because you're not going to have, like, if you just have a couple people perfectly quarantining, you're not helping the rest of the situation. So I think there's definitely a lot of communication issues too, because I think you probably know academics and researchers and clinicians are not usually the best at communicating.
Right.
And so I think in trying to communicate those shades of gray of like, hey, this is a beneficial action, people took that as a 100% mandate.
Right.
And maybe it's like we're trying to say like this probably does have impact, and it's probably a good idea to do this, and then people not being able to interpret what we're actually saying. And I definitely think we need to learn how to communicate with the public better. But I think maybe a lot of that is kind of where we're missing the public.
Yeah, and to be fair, it is extraordinarily difficult to communicate about something that you're frankly, I mean, it's not like we're basing these ideas and decisions upon years and years of research. Like this was just happening and just coming out, and to have to communicate with everybody from that sort of position about what's happening, how it's happening, what you should do about it, I think is just naturally hard. Um,
Right.
and I think where it went south is people interpreted that those shades of gray as like uncertainty,
Mm-hmm.
or allowed that space to read in like bad intentions, even with more conspiratorial stuff.
Yeah,
Yeah.
yeah, definitely. And something too is that throughout this whole process, we've been seeing science in real time.
Hmm.
And there's always a level, if you're taking the highest level researchers with the most funding and all of that, they're all going to have the forefront of information before everybody else because they're the ones actively studying it. And then with each tier that you go down, it takes more and more time to get to the general public. So the I was actually talking with Secular Rarity about this just the other day about how things that used to be cutting edge, like gravity, or anything about space, like that stuff used to be super cutting edge. Now even children learn about this, but it took time. It didn't just immediately go from highest level PhDs discovering planets down to oh, now the 5-year-old learned it. There are years and years between the discovery and then making it commonplace knowledge. And I think while we're still in these early stages of COVID being a thing, we've got the researchers like looking into this. They're not 100% sure about everything, and they're not ever going to be, but they're going to be more certain about their discoveries as time goes on. And as that time goes on as well, this information can be more easily disseminated in a clear way in textbooks and all that, because we will have kind of figured out more of the nuance. But science takes time. And like
Right.
you would know, like anyone that works for a university would know that there's a lot of time and energy and delays that go into this research, and a lot of hoops you got to jump through, like getting that getting your university to let you do it, getting that IRB ready to go. Like it takes a lot of steps to make that happen. So I think people, instead of having just this immediate access, especially having like being in an era where information is on your phone and on your computer, you can Google anything you want, and not having things that's readily available, that is something, and about something that scares you, because the majority of things that are being researched, people don't have a whole lot of stake in, so you don't really process the amount of time it's taken for all that to develop. But in this high stakes scenario, it's going in real time, and people have never had to wait for something like that to come down the pipeline, and now they have to.
Right. Right. No, that's a good answer. So I want to get to Nate's question. I apologize, Nate, for that detour. But so Nate asked, I'm curious if Ben thinks the virus is going to be endemic to the human experience, like chicken pox or influenza, or if it's something that will pass.
Oh, I think we're not getting rid of it. It'll probably change over time. Like chickenpox is now becoming less common. I think there could be a time when COVID becomes less common, but with the rate that it mutates and everything, it's more than likely going to end up being like influenza, where you're going to be vaccinated for this every year, and it's just going to be a normal part of your experience getting vaccinated for COVID, unfortunately. But at least like we have some measures now in place, and also that people are now more comfortable with wearing a mask. And it's funny that you have these cultures in like Eastern Asia where it's commonplace, if you're feeling sick, to throw on a mask
Right.
and to keep your distance from people. And we just are finally just now getting with this program. And of course, people still have their hesitations about it. But I mean, why weren't we already doing that? Like, it's just community health measures. Why wouldn't you try to protect the people around you and cover your face?
You get a shout out from David. David, thanks for stopping by.
Hey,
Appreciate it.
David's here. Good to see you.
Yeah. So are you thinking that it's will this be along the same lines as the flu shot? Like something that you're going to get kind of probably every year?
Yeah, I think
Or
so. I think they might even combine them into one vaccine. I've heard kind of talk of that coming about. So either it'll be separate vaccines that you kind of get around the same time every year, or it'll be a combined vaccine that you can just get once a year. And I predict that it's still going to be the case where employers, especially in healthcare fields, are going to mandate that. Like the panic about the vaccine mandates is funny to me, because we already in healthcare mandate vaccines. You cannot, like, and you probably know from having family in the medical field, but you can't even start a nursing school class without being vaccinated. You can't do an EMT program or anything without being vaccinated. Like anything where you're going to be in a clinical setting, you're already mandated to be vaccinated or to have certain waivers that say, I know I'm at risk. And only some of those, I think Hep B is the only one where you can really do that waiver and get away with it. But this isn't new. The vaccine mandates aren't, it's not a new thing.
right. You can't get public education in the United States without having vaccines.
Nope.
So this next question, the problem with I think it was David Foster Wallace that said that irony's dead. And so I don't know if this is a joke It could be Pete if you are joking, but then I'm going to ask you this anyway because this is an actual position that people have. Maybe they wouldn't express it like this.
Yeah.
um, but how do you, as a medical professional, deal with, let's say, religious objections to vaccination?
Yeah. I mean, with any objection, because no matter what, I want to have good rapport with my patients. And at the end of the day, I'm there to help them. And I will never force anybody to do something that they don't want to do. Like whether I agree with it or not, it's not my place to force somebody to do something with their body. Um, so I at least like to have a conversation with people and ask, like, what makes you hesitant to do this? Like, what are your concerns? And having more of like a street epistemology conversation with them about it, like figuring out what their concerns are and are there ways that we can mitigate their particular concerns. Because even a lot of people are willing to compromise if they feel like they've been listened to and they feel like they have a say. And so even asking like what are your concerns with this, and then being able to address the specifics. Like, are they afraid that the mRNA vaccine is going to give them cancer? Like, then you can talk about, well, why or why not does this occur? Help educate a little bit, but then also, like, while you're doing that, being willing to let them have the final say at the end of it. And I can strongly encourage, I can say, here's your risk that can I can see you'd have if you don't get this vaccine. But at the end of the day, you're the one that has to take the risk, and you're the one that's going to have to live with your decision. So hopefully I can get them to a place where they're willing to do it and that they understand. But if they don't, then I just have to understand that this is a human being and there's no reason to traumatize another human and put more distrust when it's something that they're not interested in. Um, and it's not fun to have those conversations, but you have to let people be autonomous. That is one of the key medical ethics. So there are kind of four pillars of medical ethics. Autonomy, of course, is one. Beneficence, non-maleficence, and justice. So justice, you treat everybody the same regardless of their background or anything. You give everybody the same standard of care that is correct for them. Non-maleficence, not I cannot speak. Non-maleficence is do no harm, so you're not going to do something to hurt somebody. Beneficence is doing good things for people. But what ends up having a lot of the debate is the conflict between beneficence and autonomy.
Mhm.
And every time, autonomy trumps beneficence. It does not matter if you're doing something good or if you want to do something good, you cannot take away their autonomy and make them do the good thing. It's like if you have someone that needs a kidney transplant or needs like a blood donation, you cannot, even if it's good for somebody, you cannot tie them down and make them help somebody else or make them help themselves. You can't make somebody take medicine. Like, you can offer it and you can explain to them and educate, but you cannot violate autonomy ever. So
Yeah, and kind of easing our way into the COVID-19 and vaccine conspiracies. I'm curious about how often you encounter this sort of thing in your like daily practice. Is this something
mhm.
that you're seeing on a regular basis? Is it kind of a once a week or once a month type thing?
It depends on the rotation I've been on. Certain rotations I've had more exposure to anti-vax people. Namely pediatrics is the big one that you see this
Mm,
because you have new parents that just they're scared. They have a brand new baby and they just want to keep the thing alive and they're feeling like they're bad parents. I think most parents feel like they're bad parents at first. Um, and they're just trying to do anything right. And they hear a risk and they don't understand. So it's usually pediatrics where you get this all this weird stuff. And then a little bit in endocrinology, weirdly enough, you get a lot of people that want to get, like, buy into naturopathy and homeopathy and things. We actually, this was an interesting one. When I was on internal medicine in the hospital, we had a lady who was admitted for pneumonia. So she had pneumonia badly enough to be hospitalized for it. So we already knew she had pneumonia, and we just needed her to get COVID tested, because we needed to figure out if it was a viral pneumonia or a bacterial pneumonia, and how we were going to treat it. Like, all it was going to do was determine the next course of treatment. And she absolutely refused to get tested. It was like this denial that was interesting. Like, we're not vaccinating you. We're not doing any, like, we just need to know what you have so that we can give you the correct medicine for it. And she was absolutely refusing, even though she was not able to breathe well enough to go home. So it's interesting, the cognitive dissonance that a lot of people have. And I wanted to bring up a point real quick about the autonomy thing, just because I know that somebody might clip that out and it might get misconstrued. But when I say autonomy, like, this is a case of, like, your doctor cannot force you to do a medical treatment. But that's not saying that you get to skip out on social consequences. Like, I absolutely think that social consequences are necessary, like not being able to go to school, not being able to go to work, etc. Like, if you don't have a good reason to not be vaccinated, I'm okay with social consequences. I'm not okay with holding somebody down and forcibly vaccinating them. So there are differences there for how I see that. Just wanted to clarify.
Yeah, no, that makes sense. Makes a lot of sense. So, and I do want to draw a distinction here between pseudoscience on the one hand and conspiracy theories on the other, because the pseudoscience regarding vaccines has been around for quite some time. I think since I think it got really popular like in the 90s. Was it Jenny McCarthy or somebody? I believe it was kind of
she is one of
perpetuated
them.
that. And so it starts off with this what I think would be pseudoscience proper, which is this idea that there's a connection between vaccines and autism, is kind of the classic scenario. So to start us off with, can you speak to that, and then we'll get to kind of malicious actors.
Yes. So there is no causal relationship between the vaccine or any vaccine and autism. This was all started based on a correlation versus causation thing, where like, in the philosophy world, you probably call it a post hoc ergo propter hoc argument of, well, this happened and then this other thing happened, therefore they're related. And it was a faulty study that kind of started this. They had a lot of sample bias. So they had people who, like, already had, like, gastrointestinal disease or something, and, like, had autism, and then, like, correlated that with who was vaccinated. And it was like, yeah, more likely the people that got vaccinated, like, had autism and all this stuff, but they had sampled from a population known to have had this specific gastrointestinal issue. So they didn't sample a random group of people. It was all from this specific patient population. So the problem is, you get all of these variables that contribute to autism, which there's more than likely genetic components and possibly also some environmental components. And the question kind of isn't, we don't really know. Is there a thing with are there any environmental triggers that would cause genes to be expressed in a certain way? We don't really know. We do know that there is a genetic component, but we do not have any sufficient evidence to say that there is a statistically significant relationship between vaccines and autism. And the argument people will often use to say that they're related is they'll take a video of somebody dumping mercury, like elemental mercury, on a neuron, and the neuron will shrivel up and die. It's like, well, yeah, you dumped elemental mercury just straight in a petri dish with neurons. That's not how this works in your body. We don't use elemental mercury in anything that you put in your body. It's all in a molecule, and the molecules we have determined are safe in the amounts that they are used, in such tiny amounts. But even so, we found different preservatives that we can use, so we've stopped using thimerosal in the majority of vaccines. So it's not even a concern anymore. But that was the whole thing. They had said, well, this type of mercury is a neurotoxin, which we know that's true. And then they've extrapolated that to, therefore, anything with mercury is a neurotoxin and you're going to get damage, which has not been proven. And also the way that, like, even if a vaccine were to have that, the blood-brain barrier is pretty incredible, and it's very unlikely for that to get into your brain without it being a very high amount of it. So dose matters a lot for toxicity. So, and that's something that people are missing as well. I wish everyone could take like an intro to pharmacology class. Like it'd be cool. Just like, hey, here's what different medicines do, and here's why they work, and don't be scared of them. Like it'd be nice little elective class.
I don't know. Pharmacology made my wife cry a few times, so that'll be a hard pass for me. It seemed pretty intense. No, but you're right. It's good to know. All right, so we've got a little bit of a doozy here. So skeptics and scoundrels ask, how much do you think the 2019 U.S. political climate exacerbated the COVID-19 pandemic?
Oh, it made everything so much worse, because like the politics basically existed to sow mistrust, and people already had some mistrust in medicine. And then when you have politicians making their entire political platform about mistrusting medicine, like, yeah, you're going to take a whole, like, half of the population with you, and you're going to stir up more panic. So it definitely did not help. And that's something that you see with kind of all of these hot button political issues, is that they'll latch on to something that's being talked about the most, and they'll make that like their entire platform. And then we're seeing this now with the trans panic. We saw it with like the satanic panic. We saw it with the gay panic. We saw it with the AIDS epidemic. Like we've seen it all across politics. Like they need something to get reelected. And so they're like, I know this is an issue everyone's talking about and people are scared of this thing, so I'm going to hop on this and make up whatever answers I want so that people will vote for me. And it's really terrible. Like legislators, apart from the ones who are doctors, we have some that know what they're talking about, and then some that know what they're talking about but are grifters and are intentionally misleading people, like Dr. Oz, for example, is intentionally misleading people. And then you have the rest of the politicians that just don't know any better and are just trying to get elected. And so the politicians who don't know anything usually know what the public thinks about certain issues, and they have a similar education level as the public. So I think they are more able to effectively communicate with other people because they don't have that communication barrier that an academic would versus a layperson. I think that's probably a lot of it. And doctors even, and I think the majority of academics shoot ourselves in the foot with a lot of these issues, simply because like I've heard way too many academics specifically say, well, I'm too smart. I put all of my time into studying my field, so I'm just not a good communicator. And I think that's absolutely arrogant and lazy. And we're only hurting ourselves by not learning how to communicate. If everyone just took if we understood that this is a skill that you can develop, like anybody can learn how to talk to people, but it's going to take effort. And I think people just aren't ready to put in that kind of social effort. But if we did, maybe we wouldn't have some of these conspiracy theories going around, because we'd actually be addressing why people are thinking the way that they are, instead of just sitting in our ivory tower of academia saying, well, I'm so detached from the rest of the world that I have no ability to interact. And I think that's killing our case.
Got another doozy for you. This is from Godless Granny. I know a woman who is anti-vax for her son, is multiply disabled. Primary issue is genetic abnormality resulting in chronic seizures. Want to ask his neurologist if a vaccine is okay for him. How do I convince her to ask the neuro doctor and not dismiss vaccines for him?
That's really hard, especially if they already don't trust medicine. But if this person trusts the neuro, it sounds like if this person has a chronic issue that they pretty frequently follow up with this neuro. So it might be easy enough to just say, hey, I think you should ask your neurologist about this, because it might be appropriate to get the vaccine. And they might also say no. The neurologist might say, no, this isn't appropriate, but at least then they have a more concrete answer. But if they don't trust, oh, she trusts the neuro. Yeah, I think it's hard because I don't know your friend super well. But I think, yeah, have a conversation with this person and maybe throw out the idea like, hey, have you talked to your neurologist about the vaccine? Or even if you don't want to call them out on specifically talking about their child, maybe phrase it like you're coming from a position of curiosity. Like ask like, hey, I know that you and your child see a neurologist quite frequently, and I was just curious if your neurologist talked to you about how the vaccine works for people with chronic seizures, or something like make it so it's not about them and it's not that you're calling them out, but like ask the question, and then maybe that would inspire them to go ask the neuro about it, because then it's more like they're getting you the answer, and then maybe they also get an answer for themselves. That might be the least hostile way to do it, because I know some people might be caught off guard, like if you're telling them how to manage their family's healthcare. I know people don't really like that. So, I mean, that would be my first step. Otherwise, if they're really not willing to talk about it, that's a hard one that I don't know the best way to communicate it if they're really not interested. But you can try that. Let me know if it works out.
Yeah, it's a tough situation. Thank you for those answers, Ben. So, transitioning here, and I wanted to end this by asking you about the conspiracy theories, and I want to still man it a little bit here, and then kind of get your response to this. So, you kind of alluded to this at the beginning of our conversation, but one of the things that I saw throughout COVID was a growing distrust of the medical community, a growing distrust of experts, and a growing distrust of the government. And oftentimes, when I would engage with these people, the biggest pushback I would get is, well, the government is known for doing this sort of things. Or like, why wouldn't they be trying to deceive us? Why wouldn't they be trying to like do some malicious sort of action here? And on the one hand, having taught like US history, like 100% I get it. The US government has a horrendous track record with Black and brown people, with the economically disenfranchised of this country, with marginalized groups of all sorts of different people. So it's kind of an impossible question, Ben.
Yeah.
How do you representing the medical community, how do you combat that sense of distrust, or where do you begin dismantling that sense of distrust?
Yeah, I think it depends a lot on the person I'm talking to and what their concern is. If they're from a minority community, I understand that a lot more. And I think that the best way to handle that particular issue is to help those people find a physician that is from their minority community. Like we're having a large increase now of uh, doctors who are people of color, and I'm seeing they're having an incredible influence on their community, because like I'm not gonna lie, like the medical community absolutely tortured those people in the past. And so it's really not a fun thing to talk about, but if you read up on any of the history of medicine, it is disgusting. It's disgusting what we've done to minorities through medicine. And so I think the biggest way to combat that specifically is for the medical community to have more minority doctors to represent those communities. Because I think if you have somebody that is trained but is also representing you, I think it's easier to establish that trust, and then some of those conspiracies can go away a little bit more. But those tend to be people, I think, that at least have some trust in the actual medicine, but maybe don't trust the people or don't trust the industry. Whereas it's a bit different when people just flat out don't trust the medicine at all.
Right.
Because like systematic things, for sure, like there's a lot of problems with the system, and then that's the case of like, how do we fix the system, or are there areas of the system that are working a bit better than others? But those tend to be more good faith conversations. Whereas with people from conspiracy backgrounds, it seems to be less of good faith conversation. It's people oftentimes that either don't know how to read the studies, which is not their fault. But some people end up getting into rabbit holes and then follow people that only they like, or like they'll only watch Fox News or something, and then they have this bias. And then a lot of them don't want to listen to the medical side. So it's hard when they don't want to, listen to the other side. It takes a lot of effort to have those kinds of conversation. I personally would use straight epistemology with them, figure out if you can get them to a place in their own brain where they understand where they messed up. It's very difficult to do. And you may or may not be successful, because some of these people have so much bias that they're bringing in that you might not be able to chip away at all of it. But trying to communicate how science works as a methodology, highlight certain points in their argument. A lot of times you'll have people that trust certain areas of medicine but don't trust others, such as they might trust a surgeon to do their heart surgery. And if you ask them, like, so if you had an issue that needed like an emergency surgery, because a lot of times people are willing to get medical care for an emergency. You just say, if you needed someone to do open heart surgery on you right now, who are you going to go to? And oftentimes they still would go to a hospital, even though that's part of the establishment that they oppose. But why is that establishment okay, but your family doctor isn't? Like, what's the difference between these two that you have that hang up? Because you trust the surgeon, but you don't trust the vaccine. So what's the disconnect? And I think it's difficult to iron out where exactly the disconnect is. But I think if you can get them to a point where you can just address that part, then maybe you'd have some more success. And it's not a guarantee. Like, none of it's a guarantee. And something that I do want to mention to the audience, because I think that it's easy to get bogged down and be hard on yourself if someone does not change their mind after a conversation with you. Like, I know you might leave a conversation and say, well, I did my straight epistemology, I had some great arguments, so why didn't they change their mind? I must not have done it right, or I did something wrong. And it might not be the case. Maybe you did everything absolutely correct, but that person was just not ready to change their mind. Like, the onus is on them to come to terms with what they believe in. And whether, like, you could be the best communicator in the world and still not convince somebody. And you can't be too hard on yourself, because that might happen.
Yeah, kind of building off of that. Do you have any resources or recommendations that you would suggest to people that, let's say, is having a tough conversation with a family member or a close friend who's expressing some doubts about vaccines and about COVID in the medical community? Where would you point to somebody to kind of help them and inform them in that conversation?
I have some videos on on the vaccine specifically. I don't have too many right now, but there are. Maybe I can see if I can put together some references, because I don't want to mislead the audience into going somewhere that might not have as good of content.
Okay.
But I've got some videos. It's a great starting place. I have debated this kind of thing on Talk Heathen before and on other shows. Medical myths, we talk about this kind of thing every week. So not just about vaccines, but about other subjects. So how to address your family and friends about whatever topic we're talking about. And I do, in all of those streams, I have my sources used there. So if I have a study that I referenced, I include that in the description. So that's definitely a place where you can find all of that. And I'll see if I can, after the fact, get you some. Actually, you know what? Here's a link this is a bit more advanced content. So not everybody is gonna benefit from this necessarily. But this is actually a resource for med students and other healthcare professionals. And I reference it a lot in my videos. It's called Stat Pearls, and I'm going to put it in the side chat here.
Okay.
Actually, I'll put it in the private chat in the StreamYard, because I don't know if it'll let me post links in the YouTube.
Okay, I'll post it for everybody.
Yeah, but you can find pretty much any medical topic there, and they do a good job at just keeping the most important points. And it'll tell you the mechanisms of, like, all the medications, all the pathophysiology of whatever disease process you're looking at. So if you just want some baseline knowledge without getting too far into the weeds, but still getting a kind of a graduate level of information, that's where you can find some good stuff.
Awesome. Yeah, thanks for sharing. And I'll also post this in the description of the video afterwards. So to kind of wrap us up here, Ben, just tell everybody a little bit again about where they can find out more about you, if you've got any projects or anything like that coming up.
Yeah, I'm on the Transatlantic Call-In show this week with Katie Montgomery. So stop in there. That is at 2 p.m. Central Time. I'm on Pacific, so, like, thinking about it in time zones, everyone knows. 2 p.m. Central Time. And then I'm on Talk Heathen this upcoming Sunday, and that is at 1 p.m. Central Time. So definitely come watch those. I have Medical Myths coming up this Saturday at 3 p.m. Eastern Time, so 2 p.m. Central Time, talking about artificial ingredients and some other food-related myths. And then Friday, I'm, like, out of order with my days, but I'm just thinking of them as I remember them. Friday, we do have trivia at 9:30 p.m. Eastern Time on my Twitch channel. So stop by there, and that's just a good time. Anyone can play trivia, and there's every couple of months we have all of the winners from the few weeks of trivia that all compete for the champ title, and the winner of champ gets a t-shirt. So there are some real world prizes involved for trivia if you stop by, and anyone, whether you're on the panel or in the side chat, is welcome to play. Anybody can win. So stop by and we'll have a good time.
That's awesome. Well, congratulations one more time on finishing medical school. And thanks again for stopping by this evening to chat with me. I really enjoyed it.
Yeah, it was a great time. Thank you for having me on.
All right. And thank you, everybody in the chat, for stopping by. And I will see. Oh, yeah, please subscribe to Dr. Ben's channel. Y'all have a good night. See y'all later.